struggling with constipation, it might be linked to your pelvic floor. Let's explore the connection and what you can do about it. So in this video, I'll be answering some of the questions like, how can pelvic floor dysfunction lead to constipation? What are the signs that constipation is related to pelvic floor issues? Are there specific exercises to alleviate constipation caused by pelvic floor problems? When should you see a specialist for pelvic floor related constipation issues? Let's answer the first question. How can pelvic floor dysfunction lead to constipation? If you think about it, there are muscles on the inside of your pelvis that work with the muscles outside the pelvis to stabilize the pelvis. When there is instability on the outside, so you're not stable there, the muscles on the inside have to make up for what's not happening on the outside. They were meant to work with the outside to basically stabilize the walls of your pelvis. And the reason that's so important is because the pelvis is your foundation to the structures above. And when the foundation is not strong, you will not have a strong structure or stable structure above. So when it's not, what needs to happen is not happening on the outside, the dysfunction begins and the muscles on the inside have to do more than they need to. It is the muscles on the inside, a specific one called puborectalis, that is directly impacting the movement of the fecal material to let it come out. If that muscle is tight, it is not going to allow the movement of the fecal material, and that creates that constipation. So if your constipation is not being fixed by your diet, then that is what's happening. So that's the correlation between pelvic floor dysfunction and constipation. What are the signs that constipation is related to pelvic floor issues? When diet's not working, when your stool is skinny, it's incomplete emptying, straining excessively during bowel movements, need to use manual pressure on the abdomen or perineum to pass the stool, need to assume unusual positions or adjust your body posture to facilitate bowel movements, pain or pressure in the lower abdomen or near the tailbone, rectal prolapse or rectocele. You can have a condition called dyssynergia, where the pelvic floor muscles don't relax properly during defecation. Those are some of the things to keep in mind. Are there specific exercises to alleviate constipation caused by pelvic floor problems? Yes. Everything that I do that is developmental exercise, that works on stability of the pelvis, becomes a fair game. If you're following my pages and channel, you know what those exercises are. And if you're not, please make sure to subscribe to the channel. Some of the exercises are scissor on the wall, quadruped, or being on all four, and single leg stand. Just remember, it's not just these three. These are basic, intermediate, and more advanced exercises. They all are showing a sample of what these exercises are and allow you to understand that these are exercises that are very easy on your joints and on your body, and yet they challenge you in stabilizing the whole body in movement. You're not an isolated body part. You are, once the spotlight is on one body part, the rest of the body still has to do its job, or you will have dysfunctional patterns of movement. That takes me to the last question. When should you see a specialist for pelvic floor related constipation issues? When you have those things that are not related to your diet, and you know that that's not helping, when this thing is chronic, the condition is chronic, when you have all of those symptoms that I mentioned before, answering that question about some of the presentations that this is pelvic floor dysfunction issues. And when it comes to choosing a specialist, that's a whole different situation there, because there are two classes of providers that treat pelvic floor dysfunction. I don't do internal work because common sense tells me I want to treat the floor, the house that pelvic floor is the floor of. So I want to know why the muscles are tight. For me to go in through the vagina and or anus trying to relax those muscles without addressing the why behind that tension, the why behind that weakness, to me is not going to last. So I hope this made sense to you. If you liked what you saw, please like and subscribe. If you have any questions, just drop them in the comment section and I'll make sure to answer them and do more videos on those topics. Until next time, take care.